I'm going to go ahead. So we're going to begin where we left off yesterday, which was on the topic of sanctions. Sanctions are basically, when HRA has certain programmatic requirements like child support and work, and if someone doesn't cooperate with those requirements without good cause, then they will be sanctioned, meaning that they will stop getting those benefits. Not completely, so the person that's not participating in those activities, their share will be reduced from the overall household's budget. So for example, if there's an adult and there's children in the case and the adult is not complying, it's like the benefits for the whole house will be reduced because they'll kind of cut the adult's benefits, right? If there's only one person on the case, they're not going to get anything, right, till they comply. That's kind of how sanctions work. Sanctions for temporary assistance are different than the sanctions for SNAP. So ones we're going to discuss right now are for temporary assistance, and later on we'll discuss the SNAP ones. They're a bit different. For temporary assistance, the sanctions only last till somebody is willing to comply. And with SNAP, they're durational sanctions. And we'll get into what that means later. So as we mentioned, because there are two kinds of waivers, if you don't have those waivers for work and child support, then you're going to get sanctioned if you're not compliant, right? So what does a work sanction look like? If the individual is already a recipient of temporary assistance, but at some point fails to comply with the HRA employment requirements, the temporary assistance recipient will be sanctioned for non-compliance and their pro rata shares removed from the household's temporary assistance grant, which leads to an overall reduction in temporary assistance benefits. Child support sanctions, this is 25% overall reduction of the entire household's benefits. So that's like literally a set amount. If you don't cooperate with the child support requirements, there's a 25% overall reduction of the household's benefits till you're willing to comply. Now, if a temporary assistance applicant has started the application process but did not comply with the child support enforcement and the work rules, then the application itself will get rejected. So for a recipient, they get sanctioned. For an applicant, you just get rejected outright. They basically say you haven't complied with the eligibility rules. Now, if you are going to be sanctioned, your client's going to be sanctioned, there is a whole process to it. So what happens is that there is a re-engagement or conciliation process. And if a client can show like the reason why they were not able to cooperate thus far, but can cooperate going forward, then they will remove the sanction and help the client get those benefits back, right? So all they really need to do to end the sanction for temporary assistance, the employment sanction, is by demonstrating compliance, meaning saying, I'm willing to work now. Or they can ask for a waiver. They can say, I'm a survivor of domestic violence, and I need to be screened by a domestic violence liaison for a work waiver or for a child support waiver or both. Okay. It could also be that, the sanction may be lifted if an individual is determined exempt from work activities. So if somebody shows that they have health issues or that they have applied for SSI and they're waiting for the application to come through, the work rules might be waived for them too. We don't see this very often, but we do see this from time to time, but it does require some advocacy. I now want to talk about some additional allowances, and we touched upon these briefly before. There are two types of additional allowances. One is called the pregnancy allowance, and the other one is called a restaurant allowance. These are some of the more common ones that our clients can apply for. So if your client or any other household member is pregnant, they can provide medical documentation from a doctor stating, number one, the expected date of delivery. Number two, that they're at least 4 months pregnant or at least 3 months pregnant if they're applying a month before, and what the delivery date is. But they won't start getting the pregnancy allowance till they're at least 4 months pregnant. So they can submit the documentation a month before to HRA, but they won't start getting the pregnancy allowance till their 4th month. Because it's not retroactive. So if you apply in your 4th month and it takes a while to process the request for pregnancy allowance, you're not going to get any missing benefits retroactively. So we advise you apply in your 3rd month with the doctor's letter. So by the time you hit 4th month, you start getting your $50 a month as a pregnancy allowance. And this is in addition to your public assistance grant. Another kind of allowance that your client can get is called a restaurant allowance. And this you can apply for your client if your client or anyone in the household cannot prepare meals in their own home because their oven or stove or refrigerator doesn't work, or they live in a kind of a apartment or shelter where they don't have cooking facilities. It's very meager, the amount. The monthly allowance for dinner is $29 and is $47 for lunch and dinner, and all other meals are $64. So it's very small, the amount. But just keep in mind, this is in addition to the public assistance grant that they would get. If a client only has a microwave or fridge, it doesn't mean that they can prepare a meal at home. So if that's the case, if they do have one of these, then you can still ask for the restaurant allowance, okay? We're now going to talk about one-shot deals. What are one-shot deals? So this is something you might come across. So what happens is if a client applies for cash assistance, they will automatically be screened for rent and utility arrears. So if a client says, yes, I have rent arrears, or if I have utility arrears, or I have both, then in addition to your cash assistance application, you're automatically also submitting an application for a one-shot deal. And you need to tell a client these one-shot deals are like interest-free loans by HRA. So let's say your client is in housing court, they have $13,000 in rent arrears, and the housing attorney says, go apply for a one-shot deal. Client says, sure, I'm applying for cash assistance anyways. I'll also apply for a one-shot deal with it. So they can apply for it with their cash assistance, or they can also apply for it afterwards. And once they apply for it, before you hit submit, HRA in fine print will say you are signing a repayment agreement that this $13,000 will have to be repaid in the next 12 months. And that's the rule for everyone who's applying for a one-shot deal, is everyone has to sign by default this loan agreement. They don't call it a loan agreement till they want the money back. And then they'll say, oh, you have this HRA loan you need to pay back, or you have this one-shot deal you need to pay back, or you're being recouped for it. And clients sometimes are very shocked. So you want to tell them up front, if you don't want to apply for a one-shot deal, don't say yes to the rent and utility arrears question, because if you do, you are also submitting a one-shot deal application, which is a loan, along with your cash assistance application. And then if at any point later on you do want a one-shot deal and you do want to pay it back, like you'll have to pay it back, then we can apply for a one-shot deal for you separately. But we can apply for it now as long as you're agreeing to pay back this loan in 12 months. And sometimes clients do freak out and say, I don't apply for this at all. And you know what you can tell them is that, that's what you want to tell them up front, is that you have to think twice whether you're going to say yes or no to this question, is whether you have rent and utility arrears, because once you check it off, you're basically requesting for a loan. And if it's given to you, they're going to want to take it back in 12 months. So one way they do it is, let's say it's not $13,000. Let's say they're only asking for $100 for their utility, turn off bill or whatever. And HRA gives them $100. Then that $100, if they are accepted for cash assistance, can be recouped from the cash benefits that they're getting. So a certain percentage of their cash assistance will be recouped every month, meaning you will get less cash every month. And over a period of 12 months, HRA will reimburse themselves for the $100 they gave your client. However, if the amount is very big, like 13,000, 26,000, which a lot of times our clients who are in housing court will have these huge arrears, then the client they might ask for the client to pay it out of pocket. And what you can do down the road is you can tell them, we can at that point say that there's hardship, you don't have a job, you don't have any means of paying, and you can try and negotiate a payment plan for them for a longer period of time, but the amount is usually not reduced. But that's not a guarantee, okay? But by default, they do have this, agreement that they're signing that they're going to pay back this amount in 12 months. Now, if your client doesn't have an active temporary assistance case, they can apply for an emergency grant, and that is called a one-shot deal, okay? However, if they have an active temporary assistance grant, then it's called a rent arrears grant, Okay, so it's the same thing, except if you don't have an active temporary assistance case and you're applying for the first time or applying for an emergency grant for the first time, then it's called a one-shot deal. And the terminology is different. If you already have an active temporary assistance case and you're applying for a rent one-shot deal, it's called a rent arrears grant. Okay. Now, they will have to follow the same steps as they do for the application, which is it's a three-part, step, three steps that you have to follow, three-part process. First is you submit the online application or in person. Second is you do your telephonic interview. And the third is you submit the supporting documents. And again, as I advise, try and do the interview within 5 days of the application. Your client has to do this interview. You can't do this on the client's behalf. And also the thing is that if they ask for a callback or whenever they pick up, it might be hard for you to be part of the interview. So you want to prep them. And usually they'll ask some questions in the interview that are related to what's been filled out in the application. Okay. And also you should try to submit all the supporting documents before the client does the interview, because sometimes they'll say, well, the interview isn't complete because some of your documents are missing, and then we'll have to do a follow-up interview. And if a client fails to do that interview, or, for some reason there's an issue with getting through to HRA, they'll say that the interview was incomplete and reject the application. Okay. So just keep in mind that you need to check off the need for an emergency need for back rent on the application or for utility arrears, and then it becomes a one-shot deal. Now, what I would like you all to do is to prepare an advocacy letter, and we have some samples to email to the rental assistance unit. So HRA has a unit called the rental assistance unit, and they're the ones that process the one-shot deal. And the reason we write to them is it helps expedite it. If they want any additional documentation, we can provide it. And also, if your clients are eligible for a grant that doesn't have to be recouped, then you can make a case for that. By default, everyone has to be recouped, but you can try and make a case for your client not to be recouped. And we'll go over what those scenarios look like in a little bit. But the idea is you have this letter ready to go. So when you hit submit application, you also hit send on your email with the advocacy letter to the rental assistance unit, so that the minute HRA gets your one-shot deal, the rental assistance unit also gets your advocacy letter at the same time, and that we have proactively worked on this. Okay. So just keep in mind, this only comes into play if a client has rent and utility arrears. We want to discuss this during office hours. Now, if a client already has an active temporary assistance case, then they're applying for a rent arrears grant, just the name is different. And it's the same, it's called rent arrears grant, or they can apply for utility arrears. Client can apply using the existing case number. And basically there is a way to apply for it. You can do it as requesting a case change, or sometimes you just have to apply for the whole application altogether. The bono attorneys will be submitting an advocacy letter again simultaneously by email as soon as the application is submitted. So exactly same procedure as a one-shot deal, just the name is different. You still have, the client will have to do an interview, online application, supporting documents, and you will still have to do an advocacy letter to send by email the rental assistance unit, which you want ready before you hit submit on the application to send to the rental assistance unit. So again, just keep in mind, whatever kind of a one-shot deal, the interview must be, or whether it's a rent arrears grant, interview must be conducted over the phone. Even if somebody has applied for this in person at the center, they will still be told the interview has to be done over the phone. You can use our phone to do it. So just keep that in mind. We prefer doing this online. Sometimes it won't let us do it online because there's some case change pending already, in which case a client might have to go in person to do it. Don't see this very often, but sometimes that's the case. Again, clients must submit all supporting documents before the deadline provided using the Access HRA app. A lot of them are not tech savvy or don't have smartphones, so you will be downloading the Access HRA app on your phones and helping the client submit these documents by screenshotting the documents page by page and uploading it. If you run into any issues uploading it, let me know. It's a bit tricky the first time you do it, so I'm happy to help you with it. We can even do it together during office hours. Also, household must submit a special grant request on the Access HRA mobile app. And that's, I think, Form 137A for rent arrears. Client needs to submit the supporting documents and follow up and interview through the phone. So again, same process, application, interview, and supporting documents. Now, what are the different kinds of one-shot deals? There are three kinds of one-shot deals. By default, everybody is applying for the ESNA grant, which is the one that's like a loan and has to be paid back. Before COVID, this used to not be the case. It used to be, we used to walk into a center and we would say we want to apply for a one-shot deal. We would have the advocacy letter with us and we would say we are applying for an EAF or an EAA. We are not applying for an ESNA because we don't want our client to be recouped. But after COVID, when everything became online, by default, it became that everybody was applying for the ESNA grant, which was like a loan. So now what we have worked around this a little bit by, we submit the ESNA, right? That's the default one. They don't say it's an ESNA grant, but that's the one you're applying for online. But then in an advocacy letter that we submit to the RAU, we request them in their discretion, please convert this into an EAF or an EAA grant. And I'll be very honest with you, that no matter how hard we try, it's very difficult to get it converted because by default, they have this repayment agreement sitting with them already. So what they're going to say is, we can't give this to you. But there's no harm in advocating for it to be deemed as an EAF or as an EAA. It's worth trying. If anything, it helps expedite the process of processing the one-shot deal loan. And at least we've documented that we've tried to ask for it. And if they try to recoup it, we can try and file a fair hearing and say, look, our client met all the criteria for these other grants and they really shouldn't be recouped. So we can try it that way, but you're going to still tell your client, most likely you're going to be recouped. By default, you're going to be recouped. But if you're lucky and in their discretion, if they can change it to an EAF or an EAA, don't hold your breath, we'll try for it. Okay. So what are these three different kinds of grants? So the ESNA grant, which is your default one, it's basically stands for Emergency Safety Net Assistance. And basically you have to show that the emergency is rent or utility arrears or a utility shutoff. You can only get it once every 5 years. So sometimes clients are like, oh, I can get this every year. No, you can't. You have to show you're only getting it once in 5 years. Your income has to be below 125% of the federal poverty level. And especially if no unforeseen emergency. And you have to pay it back over the next 12 months. And you can tell them, we can try to negotiate it afterwards for a longer period of time, but we can't change the amount. Again, you can't hold us to this because they have it in writing that you are going to pay this for 12 months, but we can try with the advocacy. Now, what is the EAA grant? EAA grant stands for Emergency Assistance to Adults. In this, you have to show that there is an emergency that was basically the rent arrears or the utility arrears or utility shutoff, and that there's an adult in the household that is in receipt of SSI, which is a kind of disability benefit. And you can get this once a year and you don't have to pay it back. However, by default, you're applying for ESNA. So we can only try. This is slightly easier to convince them compared to the EAF grant. Again, it's still, even though it's easier than the EAF, both of them, HRA doesn't want to make any commitments that they're giving this to you. They'll never want to put it in writing since COVID. So it's hard to make this case, but we still always try. Okay. And usually we have to show that a client is a US citizen, everybody in the household is US citizen, they're in receipt of, somebody in the household, an adult is in receipt of SSI, and that they, haven't applied for it more than once a year. Okay. So that's usually an advocacy letter that we will send to the rental assistance unit, along with a copy of the one-shot deal application. What's the EAF grant? This stands for Emergency Assistance to Families. You have to show that there was some kind of an unforeseen or uncontrollable event that triggered the emergency, except for utilities. And you usually can show that there was some kind of a natural disaster like a hurricane, or there was gender-based violence, or utility turn-off notice, or you're about to be evicted, to show that there was an emergency that was an unforeseen or uncontrollable event. You also have to show that there's a child under 18 or 19 unless in high school or equivalent, right? Equivalent would mean like a GED program or something. Household's income has to be below 200% of the federal poverty level, slightly higher than for ESNA. And you can get the EAF once every 5 years. So the EA is a little bit more generous. You can get it every year. The EAF, you can get it once in 5 years. And you do not have to pay it back except for rent arrears. So basically, what they say is that they look at the shelter allowance and they say, as long as the money that you owe in rent arrears is an equivalent of 6 months of shelter allowance, that amount you don't have to pay back. Anything in addition to that or in excess of that, you do have to pay back. For utility arrears, is for the last 4 months of the billing period. If it's monthly, or 2 months if the billing period is bi-monthly, is the amount you don't have to pay back. Anything in addition or in excess of that, you do have to pay it back. Also, you cannot get an EAF if your case is sanctioned. So if you're not complying with the work or child support requirements and you don't have a waiver, well, then you're not going to consider you for an EAF grant. Also, you have to show future ability to pay rent. And they also kind of look at that for ESNA, right? Because the only way they're going to approve you is if they think you're going to be able to pay back over the next 12 months. So if your client doesn't have a job or any source of unearned income, they might not approve your client's application. For EAA, you don't have to show future ability to pay rent. But remember, everybody by default is applying for ESNA. I'm going to hand over to Anna, who's going to tell you about Fair Fares.
Hi, I'm Anna Colado. I'm the project assistant for the Matrimonial Economic Justice Program, working with housing and public benefits. So for Fair Fares, what is it? It's a program created to help New Yorkers with low income manage their transportation costs. So by using the Fair Fares MetroCard, New York residents will be eligible for a 50% discount on all subways and eligible bus fares. Clients must choose if they want the discount on a regular Metro card or the discount on an Access a Ride. That's typically for people with a disability that need to get somewhere with car rides. So for this 50% discount, only adults between the ages 18 to 64 are eligible for it. How to apply? The application is through the Access HRA portal on the Fair Fares tab. Similar to the cash assistance application, it asks your income and address. There are no required, no budgeting is required. After the application, you'll have to submit some required documents and proof of address. There's no interview that's needed for the Fair Fares program. Once you're approved, an Omni card will be mailed to you, and that's around like 2 weeks after the application is done.
Continue, you'll see Anna in a little bit again. She's going to take you through the application process. So you'll have more face time with her then. Now we're going to move on to SNAP benefits. So we are done pretty much with the temporary assistance part of the training. We've covered Fair Fares, which is your discounted MetroCard or Access a Ride program. And now we're going to talk about SNAP, which stands for Supplemental Nutrition Assistance Program, formerly known as food stamps. And so you'll see the clients saying the word food stamps a lot. I say it too because I'm just used to saying it, but really the proper terminology for it is SNAP. Food stamps is the old name for it, okay? So what is SNAP? It is money provided once a month onto your EBT card, and you can use that card to buy food from vendors that accept EBT card as a payment form. So basically, it's money that's put on your EBT card to buy food, and it's for low-income individuals and families, so their income limits, right? SNAP budgeting is totally different than temporary assistance budgeting, and we'll go through that shortly. Just remember that this money cannot be withdrawn as cash. And also, it's a federally funded benefit. There's a lot of information in your public benefits manual in the portal. You can read more about it. Just remember Most of the clients you're going to be helping are not going to be eligible for SNAP. They might have a family member, for example, like a US citizen child who is. But if you need to figure out somebody's immigration eligibility for benefits, we'll take you through that and we'll discuss it together. Also, with the new bill that's been passed, which hasn't been implemented yet, a lot of our clients that have sought immigration status on the basis of, humanitarian grounds, they are going to be losing their SNAP. We're not creating any alarm right now by telling clients because it hasn't happened yet, but we will be seeing that. And when it happens, we will keep you abreast of it. But for now, just remember, everybody who's eligible for SNAP is getting it, including clients who have obtained status on humanitarian grounds, okay? But as you all know, there are cuts coming. And so our clients are going to be hugely affected by that change. However, most of the clients that you're dealing with, they're migrants and they're not even eligible for SNAP in the first place. They're only going to be eligible mostly for temporary assistance and Medicaid. So the only reason we are educating you on what SNAP is because a lot of these clients have something called a mixed household or a multi-suffix household, which means that there are people in the household that are migrants and are only eligible for safety net assistance and Medicaid or temporary assistance and Medicaid, but not SNAP. But then they might have household members that have different immigration statuses who are eligible for SNAP. So when you apply for the entire household, if there's anybody eligible for SNAP, you are helping them apply for that, even if your client isn't, okay? There are two prongs of eligibility for SNAP, immigration eligibility and income eligibility. I wanted to say that the resource eligibility only comes into play if a household's income is more than 200% of the federal poverty level. And that's usually not really the case. So only if somebody's income, household income, is more than 200% of the federal poverty level, only then the resource limits apply to them. Also, if they have committed some kind of, they've been, they have committed some kind of intentional program violation, which means there was some allegations of fraud or they were recouped and didn't pay or something like that. Then in some of those cases, the resource eligibility test comes into play too. Most of our clients don't have that, so we don't usually have to worry about the resource eligibility. But if you're worried that your client's income is over 200% of the federal poverty level, which I have included the chart previously when we did the temporary assistance budgeting, then come to me and we can talk about the resource rules and or if there was an intentional program violation on their case before, for some reason they were taken off benefits or were denied benefits or were told that they had committed some kind of intentional program violation, then the resource test might apply to them too. The ones you really need to worry about are the immigration eligibility and the income eligibility. For immigration eligibility, on the portal, I have uploaded these cascades and the relevant policy directives. And so, and I'll show you a snippet of the cascade so you know how to read it. But usually you are not going to be figuring out the immigration eligibility on your own. We'll be doing that together, right? So of course, for your client, they're migrants. Most of them, where they're eligible for safety net assistance or Medicaid, because they will probably have a receipt notice as asylum applicants or a judicial stamp on, their order, on the application. So we know that they're eligible, but it's more about the other members in the household. Are they eligible or not? So we will, when we have office hours, confirm everyone in the household's immigration eligibility together, unless you're able to figure it out. And if you have, just confirm it with me because, nobody's an immigration attorney here. So we want to make sure that you all understand that. I'm also not an immigration attorney, but I work very closely with our immigration intervention project. And I'm trained on the common statuses, for our clients and their households. And I know their eligibility for benefits. And even if I have a question, I can reach out to the immigration attorneys and confirm something, right? So just want to make sure we're doing this together. If you have any questions or the other members in the household that are non-citizens. Of course, if they're a citizen, we don't have to worry about it. They're eligible for everything. The other place that we have, other thing that we have added and the policy directives are the policy directives. And these are from the OTDA website. There are lots of policy directives that come out over time, year after year, month after month, and only the relevant ones are the ones that we have provided to you in the portal. So if you need them, they're going to be there. That's a great first place for you to look. And of course, you can ask me questions too. Sonia, what are the relevant policy directives in this case? And I can point those out to you or send them to you. Income eligibility for SNAP, we will be doing this in detail as well. This is kind of more simplified. So the actual information on how we do SNAP budgeting and SNAP budget rules are laid out in the SNAP source book. However, a lot of nonprofits have come up that do education and training have come up with budget worksheets for SNAP. So Community Service Society has one, Hunger Solutions have one. We like using the Hunger Solutions one, and we have added that. And it's a really quick way to check if your client is income eligible. We don't have to sit and figure out the rules on our own. We literally go and punch in the numbers in our worksheet, and it'll tell you if your client is eligible and for how much. So it's a really great way to do that. And we will be taking you through that in our training by doing an example or case study. And if we don't have time for the case study, you can review it on your own. And if you have to do budgeting for a client, happy to do it with you during our office hours. So this is what the non-citizen eligibility cascade looks like. The whole cascade is included in your portal. This is just one page of it to show you how to read it, right? So on the left-hand side, it shows you the description of status. So for example, if somebody has applied for temporary protected status, what do they need to have in order to get these benefits? So for example, if they have applied for a temporary protected status, they need to have an employment authorization card with A12 code on it. And then what are they eligible for? They're eligible for safety net assistance and nothing else, and just Medicaid, okay? However, if they're an applicant, it might be different. So that is in a different policy directive, and we went through that already. So same for asylum applicants. In this cascade, it shows an asylum applicant with an employment authorization. I think we only have one client in all the cases we're signing right now that has this, because usually the trajectory for an asylum application is you apply for asylum, and then you get a receipt notice, and then you have like biometrics, things like that, and then you get an employment authorization card, and then later on, you have a hearing for asylum, and then your asylum is either approved, or not, rejected or denied, right, or approved. So however, they don't need all of these documents to apply. They can apply if they just even only have applied for asylum, and that is in the policy directive that we mentioned to you earlier. So if you have an asylum applicant, don't look only here. You have to look at the policy directives for the migrants that I have mentioned earlier on in the training, okay? But of course, if your client has an employment authorization document, they need to show that they either have a work permit with the C8 or CO8 code on it, or they have an asylum application that is received or pending, and that the non-citizen is authorized to work in the US, etc. So that's how you read the this policy, this cascade. So you move from left to right, and you see what benefits are they eligible for. And again, if you have any confusion, you let me know, and we'll discuss it together during office hours. So what we have screened for sure is the clients and their immigration eligibility. What we haven't screened for is everybody in their household's immigration eligibility. So this is something we do have to figure out together. So when you call your client and you ask them who else is in your household, and you ask them what what kind of applications have been filed for them or not, that is something we will need to check. If it's just them, then it's easy enough to figure out. If it isn't, we'll have to figure out the immigration eligibility for everyone in their household for the different benefits, okay? And if they aren't eligible, they won't be included in the application, but their income and resources still will be. So this is where the policy directives are listed on the OTDA website. Again, as I mentioned, the ones that are most common to our clients have already been provided to you in the portal. And if there are any other that you need, I can guide you to them. And this is what some of them look like, the policy directives. So this is the one that is the most relevant to your client, which is 23 TADC 039. This has been included in the portal. And this basically says, lists out everyone who's eligible for safety net assistance because they have some kind of an application pending. So for example, if you have an asylum application pending and you have a receipt notice, this is the general information system message or policy directive that makes them eligible for it. Same for Medicaid and so on and so forth. Now, this is what a SNAP budget worksheet looks like. So now we're coming to SNAP budgeting or SNAP income eligibility. And so, of course, the form itself is much longer. The worksheet is much longer, but we have annotated it. So I've taken little snippets of it in order to explain to you what these different lines stand for or what should be going there. So number one is that you have to calculate the client's gross monthly earned income. By the way, this changes, this worksheet number or the way it's calculated changes every October 1st, right? As you can see, this one is only applicable till today. So we have a new one that's been uploaded to your portal. And so since you'll be applying for clients after October 1st, you'll be using that one. But it's really all the lines are the same. Some numbers might be different, but the way you calculate it is the same. Have any questions using the new one? You can let us know. But just because today was September 30th and this budget worksheet runs till September 30th, we had to still officially use this one to show you all how it's done. So now, unlike temporary assistance budgeting, where gross monthly earned income, HRA says they're 4.33 weeks in the month. For SNAP budgeting, they usually say they're just 4 weeks in the month. So you can just say if a client gets paid on a weekly basis, you multiply that into 4 and you get the gross monthly earned income. Okay. Now, if your client gets paid on a bi-weekly basis, you divide it by 2, you get the weekly income, and then you multiply it by 4. If your client gets different amounts every week, which is again very common for our clients, we add it all up, divide them by 4, get an average weekly amount, and that's the amount that we will multiply by 4 and get the monthly amount. Okay. Or you can, if it's just weekly amounts, add up the 4 and you can get the monthly amount as well. Now, you want to use the income before taxes. So if the client gets paid different amounts every week, you add up the last 4 pay stubs to get the gross monthly earned income. However, as we said, if it's bi-weekly, you divide it by 2, get the average weekly income, and you multiply that into 4 to get the monthly income. Now for line 2 is if a client gets unearned income. And this is very important to ask because a lot of times we just assume, oh, the client's only saying when you ask them, do you have any income? They only talk about whether they're working or not. But we forget to ask them if they have unearned income. And sometimes the clients have unearned income. So even the cash assistance that they get or the basic allowance that they get is unearned income. And if they get cash assistance already and you're helping them apply for SNAP, we have to add that amount here. If they're not getting it yet, and you're applying for it, then you put down 0 for cash assistance, right? So only if they're actively receiving cash assistance for their household, would you put that down here. He and Shia, that also comes in as cash. So you would also put that amount here. You would add it up. And rental or shelter allowance, any child support that they might be receiving, any child support incentive payments they might be getting, SSI, workers' compensation, unemployment, social security, retirement benefits, income from friends and family, all of this counts as unearned income. And if they have multiple sources, we would add that up and put that in line 2. Line 3 is the child support paid. This is again a rare situation because usually we end up putting 0. This is only if a client doesn't have their children with them and is paying the custodial parent child support. Then you will add it because on line 4 and it will get subtracted from the client's monthly earned and unearned income. Okay. So this is just to take into account this expense that they might have. And if they don't pay any child support, that you put down 0. Now coming to line 6 This is the earned income deduction. You take line 1 only if you have earned income and you multiply that by 20%. If your client doesn't have any earned income, this would be 0. Line 7 is the standard deduction. This is dependent on the family size. So you will see on page 2 of the budget worksheet, they have a little table there, a little chart there, and you can see based on household size, what amount you need to enter here. And then for line 8, this is for dependent care. So this is if you're paying for adult care or child care, or if you're job searching and you need it. You can't get this deduction if you're sitting at home and you're not looking for work, or you're not looking for, or if you're not working, or if you're not looking for work, or if you're not in a training program, or you're not in an education program, etc. Only if you're literally out of the house, seeking employment, doing your work, attending trainings, pursuing education, or preparing for employment, only then will you get this. You can put this down. Homeless deduction, this is tricky. And the reason is that if a client is in a shelter, they don't get this. So only if a client lacks permanent housing, meaning they're on the street, like they're street homeless, or they're couch surfing, that you get to add $190.30 for this line. Okay, so if they are in a shelter, they don't get to take this homeless deduction. Again, if you're confused, you can talk to me in office hours. Medical expenses over $35. This is only available if your client is elderly or disabled, and only if they don't have Medicaid and they have bills that they're paying out of pocket that are over $35 a month. For rent or mortgage, this is also very interesting. The amount that you will put down is the amount the household actually pays. So for example, if your client is getting rent paid by different government subsidies, such as Section 8, SCREE, DREE, HASA, FEPS, City FEPS, you don't put that amount as a portion of rent that is paid by third parties to the landlord. Only if an individual is paying themselves, whatever portion they're paying themselves, that will be counted as the rent amount here. So usually if you ask a client, what's your rent? They'll tell you the rent that's on their lease, but you need to ask them if they're getting any extra money from the government subsidies that are listed here, okay? Standard utility allowance. This is dependent on the utilities that they pay, and this is what it looks like. So this is what the second page of the worksheet looks like, is it will show you your standard deductions, your maximum SNAP amounts, and also your standard utility allowance. So we are discussing the standard utility allowance right now. There are 3 levels. If you're living in New York City, most of our clients are living in New York City. So they can put down level 3 if they only pay a phone bill, okay? However, if they are paying an electricity or a gas bill, we will put down level 2, even if they have a phone. But as long as they're paying an electricity or gas bill, you get to put down a higher level. And if you're paying for air conditioning or heat, even if it's through electricity, you get to put down level 1. Okay, so just remember that the higher the standard utility allowance, the more deductions kind of our clients get when calculating their budget. Okay, so the more bills your client has, it's the more benefits they kind of are able to get in SNAP. Okay. Again, if you're confused about this when you're doing the budget worksheet, we can do it together and help you figure it out. Also, these bills have to be on their name. Now, we have a lot of slides on the SNAP work requirements. However, I am not going to go through all of them in a lot of detail. I will just give you the general information and tips. And then if you have any specific questions, you can ask me during office hours, only because a lot of our clients won't be applying for SNAP. So I don't want to spend too much time on it. But the main thing that you need to know is that there are general SNAP work rules, and there are some additional work rules for people who don't have dependents if they belong in a certain age group, and that's called ABOD. So we'll take you through ABOD later. But the general SNAP work rules, everyone has to follow. And the rules are, you have to accept any job offer you receive unless there is good reason that you can't. If you have a job, you can't quit the job or choose to work less than 30 hours each week. The general work requirements are you have to work 30 hours each week, unless you have good cause, such as you're sick, you're being discriminated against, or not getting paid. You can tell HRA about your job and how much you're working. But if you don't have an existing job, then HRA will place you in their SNAP ENT work activities program. And if you say no, you're going to be sanctioned. And SNAP sanctions are durational, and we will go through that in a little bit. Okay, these are some exceptions to the rule. So you don't have to follow these rules if you're younger than 16, over age 60 or older, etc. So you can go through this list and see who is an exception to this rule. Okay. Otherwise, everybody has to work at least 30 hours a week. Now, what are SNAP ENT assignments? This is usually that HRA will put you in a program where they will either put you in a job search program, a job readiness activity, community activities, job skill trainings, vocational trainings, educational trainings, apprenticeships, subsidized employment, or place you for work. And that's what SNAP ENT is. If you don't have a job, or if you're not enrolled in an HRA approved education or training program, they will assign you to it. Okay. And they get, if they're in this program, they receive case management, etc. Now, if HRA assigns someone in a household to participate in a SNAP ENT program, they cannot ask clients to participate in SNAP work activities for more than 30 hours a week. If a client wants to do more, that's fine, but they can't assign them for more than 30 hours a week. Okay. So if a client chooses to, they can work more, but they cannot be required to. Now keep in mind that if somebody is on SNAP and have to comply with the SNAP work rules, the SNAP work rules are that you have to work at least 30 hours a week, right? But for cash assistance, those hours can be more if you don't have dependents. The hours are 35 hours minimum. However, if you don't have dependents, and it's 30 hours a week minimum if you have dependents, right? So if you are a household that has dependents and you're already doing your 30 hours of cash assistance work requirements, you don't have to do an additional 30 hours to meet your SNAP work assignments, because those 30 hours will count for the 30 hours for SNAP as well, right? Because you're already doing it for cash, the work hours, those 30 will carry over to the SNAP. However, if you're meant to do 35 hours a week for cash assistance, then you need to do those extra 5 hours for cash assistance, but for SNAP, you don't have to. You just have to do a minimum of 30, okay? Now, if your household is going to incur costs to participate in the SNAP ENT activities, such as transportation, like MetroCard, childcare, etc., then HRA has to reimburse them for that. And if they don't reimburse them, then somebody can temporarily excuse themselves from participating in that activity and, basically say, I didn't get the stuff that I need, like my transportation covered or childcare reimbursed, etc. Until you give me that, you need to excuse me. Okay. Now, if HRA tells someone in the household that they must participate in a SNAP ENT work activity, the person must participate or provide proof that they are already gainfully employed or in HRA approved training program. If the person does not participate or quits the job willfully or without good cause, they're going to lose their SNAP benefits. Okay. So there are some examples of good cause reasons, and we've listed some of them here. So there's some examples of what that looks like. For example, a letter from a doctor that's treating you, etc. Now, I mentioned to you that cash assistance or temporary assistance sanctions are not durational, which means as soon as you say I can comply, or as soon as you get a waiver, those sanctions are lifted immediately and you start getting your benefits again. Or you get them back to the same levels if they were reduced, right? Now for SNAP, it doesn't work that way. Even if you show willingness to participate in an assignment, you cannot get SNAP for 1 month. The first time you get sanctioned. The second time you violate the work rules, the general work rules, and don't participate in the SNAP ENT assignment, you can get sanctioned for 3 months, which means that your household cannot get SNAP for 3 months, even if they reapply and show willingness to work. The third time, and any more times after that, they are barred from getting SNAP benefits for 6 months. These are durational sanctions, and the person must follow these work rules to get the SNAP benefits again. So for example, if that's the third time they've gotten sanctioned, before the 6-month sanction is over, they have to show that they're working so that they can start getting their SNAP after the 6-month sanction is over. Okay. A person who loses their SNAP benefits because they did not follow the general SNAP work rules or did not complete a mandatory SNAP ENT assignment must be allowed to start receiving SNAP benefits before the end of the time period noted above if they can prove that they can be excused, they should be excused from those work rules, okay? So if you can show that your client can show that they can be excused from the work rules, then you don't have to wait for the sanction period to end. The sanction will end as soon as you can show the good cause for being excused, okay? If the person in the household is also sanctioned for cash assistance, they may be able to regain their cash assistance eligibility by demonstrating compliance right away. So as I said, it works differently for cash. For cash, it's not durational sanctions. So you can get your cash right back to its original levels if you can show demonstrated compliance. However, it doesn't work like that for SNAP. You're barred for a certain time period. I'm going to talk very briefly about ABOD. ABOD stands for Able-Bodied Adults Without Dependents. And this is a term that is used for individuals that are between the ages of 18 to 54 who are capable of working and don't have dependent children. I believe that with the new bill that's been passed, this is changing from 14 to 64. However, it's not been implemented yet. But keep in mind that in New York City right now, the work requirements for ABOD have been waived to February 28th of 2026, which means that they don't have to do these additional hours of work. So anybody who's ABOD has to comply with the general work requirements of 30 hours a week, plus an additional of 20 hours a week, so that they have an additional of 80 hours per month to show that they are participating and doing the additional work activities as ABOD. However, right now in New York City, this is waived. This requirement is waived till February 28, 2026. So if you're ABOD, you just need to do your general work requirements like everybody else on SNAP. You don't have to do the extra 20 hours a week till February 28, 2026. Okay. Now, WIC. This is the Women, Infant, and Children program. It's a supplemental food program. And the great thing about it is that there's no immigration requirement for it. There is an income requirement for it. You have to be below 185% of the federal poverty level. What is the WIC program? Basically is a supplement food program. It's separate from SNAP. And what it is it basically provides things like formula, juice, things like that. Not as much as you can get in SNAP, a very, very limited amount for people who are low income, pregnant, breastfeeding, and non-breastfeeding postpartum women, and infants and children up to age 5 who are found to be at nutritional risk. And there's a whole way to do this, is you have to call up the WIC agency or make an appointment with them. And there's a whole link to the application. And it's not complicated, right? It's not as complicated as applying for temporary assistance in SNAP. But you will have to provide proof of income. If you don't have any, you can provide a signed statement, proof of residence, which just means that, if you don't have a lease or anything, you can mail a letter to your client and they can show that envelope as proof that they live there, or a utility bill, proof of identity. It can even be like a passport or something that they might have from their country, or a New York City ID, and a medical referral form that you need to bring to your appointment. And again, everything is linked here for you all to see as part of the application and information around it. Again, you can come to us during office hours and we can discuss this. This is a very important resource because every dollar counts for our client. So if they get in SNAP and can get WIC, why not also get WIC, right? Or if they can't get SNAP, at least WIC will help them get some food, better than nothing, right? Now we're going to talk about Medicaid. What is Medicaid? I'm sure most of you are already familiar. It's a health insurance for low-income people. And the way it is structured is that people are categorized as either Magi or non-Magi. So what are Magi populations? They include pregnant women, dependent children under 19, parents and caretaker relatives of children under 19, adults 19 to 64 without dependents who are not entitled to Medicare. What is non-Magi populations constituted of? Disabled people aged certified blind. Most of our clients will fall in the Magi population. And remember that if they fall in the Magi population, then we are helping them apply for Medicaid through the New York State of Health website. We usually call them, but I prefer that to the online website. It usually has a lot of hiccups, takes a very long time. It's usually much more straightforward to do it over the phone. But remember, most of your clients are going to be Magi, and we're going to be helping them apply for Medicaid first through the New York State of Health. However, if your client is disabled, aged, or certified blind, or has anybody in their household member, that is, then for them, you need to apply for Medicaid through HRA. And you don't have to do that first. You can do that when you apply for the cash assistance. You can apply for Medicaid at the same time then. However, if you are Magi, you need to take care of that first before you help the client apply for temporary assistance or food stamps. Okay? Because we explained this to you earlier, when they apply, if they don't apply through the marketplace first and don't get Medicaid through the marketplace first, which is where they should be getting it from, HRA by default, when you apply for cash assistance and SNAP, will basically force them to get Medicaid through HRA and lump that as part of the application, and that's not where they should be getting it from. And if they're getting it from there, then we have to close the entire case down and go back to the New York State of Health and say we want to apply for you all from you all first, and then reapply for your cash and SNAP, so that when they are, when they apply for Medicaid through HRA at that point, they get rejected for HRA Medicaid, which is what we want to see for Magi populations, because it will say you already have Medicaid through the New York State of Health. And that's exactly why they should be denied through them, because they shouldn't be getting it through them. Okay. Now, if your client is not eligible for Medicaid, then you can apply for some other kinds of health insurance, and you can do that through the New York State of Health. Okay, so the New York State of Health, when you call them up, they'll say you're not eligible for Medicaid, but you're eligible for the essential plan or the qualified health plan, and these have different income limits. So for Medicaid, the income limit is 138% of the federal poverty level. For the essential plan, it's 139% to 200% of the federal poverty level. And the qualified health plans are for people whose income is above 200% of the federal poverty level. So sometimes this involves like some co-payments that a client might have to make, or some kind of a premium that might have to pay, but it's definitely cheaper than something they can get just from, outside. Like the New York State of Health is much more subsidized. So I recommend that the client, if they're not eligible for Medicaid, try and explore these options through the New York State of Health. Now, if they can't afford these premiums or these co-payments, then you want to apply for charity care programs at public hospitals, or the New York City Care Program, which is for uninsured people, where you get sliding scale fee care at participating hospitals. Okay, so you don't have to have any immigration status for this. And basically, for $15 to $20, you can see a doctor. You can get surgery for $150 to $200, and you can get prescription medications for $2. I mean, I'm just, quoting these numbers. They might be slightly more or less. Don't hold me to it, but it's much more subsidized than if they were paying out of pocket. Now, going back, how do you apply for Medicaid through the New York State of Health? You basically call up this helpline. You can also refer a client to an assister or broker, or you can complete the application online. I prefer that you all make the call, but as I said to you before, you have to make sure your client has your name, date of birth, your law firm's name, and they will ask you for the Social Security number. You can say that you don't want to give it, and they can't insist that you give it, but basically they will first speak to the client, some basic question. The client, if they need an interpreter, you can prep them beforehand, ask for an interpreter. And then when it's time for to do the application, they should say, I want to now have given 24 hours permission to talk to my attorney. Please talk to them now. And then you can have the client on the phone, but you can do most of the talking for your client. And you're going to need things like your client's immigration status, social security number, things like that, to provide to the New York State of Health during your intake call. And they will tell you at the end of the call if a client is eligible or not, usually. Sometimes they'll ask you to send in the client's immigration status to them, and you will provide that to them. You can ask them how. It's usually by fax. Now, for those people who have no immigration status but are having an emergency, they can go to an emergency room, either through an ambulance or directly. And if the emergency room doctor treats them and qualifies their treatment as an emergency treatment, then the client will get something called emergency Medicaid, and they'll have to pay zero for their hospital bill and their ambulance bill. However, if the emergency room doctor doesn't think it's an emergency, then the client will be billed for it. Okay, so you can say it's an emergency, but unless the emergency room doctor thinks it's an emergency, you will not get that emergency Medicaid for it. PCAP or Prenatal Care Assistance Program, this is for pregnant women, also children under age 19, regardless of their citizenship status, as long as, so basically as follows: full Medicaid services for pregnant women with incomes at or below 100% of the federal poverty level, and comprehensive perinatal services for women with incomes below 100 and 200% of the federal poverty level. So regardless of your immigration status, everybody who's pregnant can get this. Again, these rules might change down the line with the new bill, and we'll keep you all posted, but for now, this is the rule. What is Child Health Plus? This is the kind of health insurance for all children under age 19, as long as they're residents of New York. It's regardless of their citizenship or immigration status, as long as they have income below 400% of the federal poverty level. Okay, I'm going to hand over now to Anna. She's going to take you through the application process.
Step-by-step guide on applying. So first you're going to go to the Access HRA account. If you don't have an account, you can press the login, apply now button and create an account, or right underneath it. If your client does not have an email address, you can also help them create an email account. After a client creates an account, this is a screen that will pop up when it makes them log in for the first time. You can either fill in this information or hit skip without any negative consequences, and that's only the first time. Once you have an application and it asks you all of the stuff it is required for you to fill out, like the date of birth and social security number it usually asks for, and date of birth. And you will need that so you can link the application with your account. Step 3 is apply. So you can click on which application you're interested in filling out. The clients are also able to select what language they would prefer to apply in, as well as get their notices in. It's important that after you complete the application that you screenshot the confirmation number at the end of the application process. Or you can also download the application and save that with the confirmation number. It's important to keep checking the Access HRA website every day for any updates, as well as having your client check that, and also their mail for anything that they might receive. The deadlines are very important, and it's crucial that those deadlines are met. A client's application can be denied for not completing the application process, or if not all of the supporting documents are uploaded on time. If a client misses the document submission deadline, or having a hard time getting their documents, or cannot reach HRA for the interview, they should try to do something as soon as possible. So either reaching out to you or calling the number on any of the notices to make sure that they are not denied. The Pro Bono portal also has sample documents that explains the type of documents that can be submitted. not all of the documents need to be submitted for each category. For some of the categories, one thing is enough. Some clients will not have a social security number at the time of application, so we recommend that you upload their qualifying immigration documents. And both of these policy directives show the category of social security number. You can also, you can say that they don't have a social security number, and you can also upload an advocacy letter explaining the client's eligibility for public benefits and reference to these policy directives in it. There's also a sample letter in the pro bono portal that you can take a look at to see what that looks like. It's important to report all types of income that clients and families make. If they're working off the books and they cannot get their employers to sign a document, it is best to have a self-certification of their employment. As documentation proof, the working person can write a letter saying how much they make per hour, how many hours per week they work, and when they started their employment. The letter should have the client's signature, date, name, and all printed at the bottom. If you need instructions on how to do this, please contact Sonia. We also have some example letters of what that looks like. After the application, you will need to connect the case with the Access HRA portal. So this is what we were talking about before. To do so, you will usually need a social security number, a Fair Fares ID, or an existing EBT ID number that is usually found in the back of the EBT cards. Sometimes when clients do not have social security numbers or Fair Fares or the CIN number, they will need to call this number on the screen, 718-557-1399, to get a temporary CIN number. So they're able to connect their case with the Access HRA portal after their application. You can call and say that you need a temporary CIN so they can monitor their application process through Access HRA. Once you're able to reach a worker, they will give you a temporary CIN number over the phone. And after you give them the application confirmation number, you can confirm yourself as an authorized representative. You do not need to wait for an email or any mail. You can write down the number just so you can add it to Access HRA. You can access the SIN number only if you are listed as an authorized representative on the application, so please make sure to do so. This step is usually when once you're submitting the application, it'll ask you if you want to add someone as a authorized representative, and that's where you can add your name and email.
So we are going to be walking you through a sample application, and it's important to know, like, they're going to ask you in the application for each household member whether they are a citizen or non-citizen. So as long as they're not a citizen, you're going to be putting down non-citizen. You don't have to put down the exact immigration qualification, just non-citizen is enough. You also don't need to list an undocumented household member if they are not an adult payee for their children that are minors, or if they are not eligible for benefits themselves. For work requirements, we've already been through this. If you have any questions, you can come to me. For child support requirements, again, you can. We've gone through this. The reason it's important to mention it here is you want to educate your client about these requirements before you do the application, because a client doesn't want to be surprised after they have been accepted for an application and get a letter saying you need to work or you need to comply with child support requirements. You want to educate them beforehand, right? Also, the thing is that if they need to get a waiver, you need to discuss with them that option beforehand and what that will look like, right? And if a client does want to get a waiver, then they have to identify as a domestic violence survivor to get screened by a domestic violence liaison at a special assessment appointment in order to get a work or child support waiver. I wanted to add one more thing is a client might also be asked to come to work appointments or child support requirement appointments during the application process too. So it's not only that they will be asked to comply with it once they are approved. They can even be asked to attend these appointments during the application process, which is why you don't want your client to be surprised that they're being asked to meet these appointments. You will also need to collect about 4 to 6 weeks of pay stubs from your client to show earned income, and also collect any information about any unearned income that they're getting. So collect any evidence from them. If a family member is assisting them that doesn't live with them, you want them to write a letter for you. If they're getting, workers' compensation, you want their workers' compensation award letter and so forth. You also want to tell your client before you apply that they're going to screen you for rent and utility arrears at HRA. So if you respond yes, that you have those arrears, then you're also submitting a one-shot deal loan application along with your cash assistance application, and you will be recouped for it in the next 12 months. So just remember that by default, the one-shot deal is an ESNA grant, which is a recoupable grant. It's like a loan that you have to pay back. And everybody is, if you say yes to rent or utility arrears, then you're by automatically signing a loan agreement with them as well for that amount. If your client belongs to a household where everybody is already, who's eligible is already receiving benefits, but is now become eligible themselves, well, then we don't need to fill out a whole application. We can just request a case change on Access HRA to add them. But that doesn't mean that they won't need to do supporting documents or an interview. They will still need to do that. And also sometimes HRA glitches and Access HRA glitches and doesn't let you do it online, in which case then the client would have to go down to the center and add the household member. You also want to have a list of documents that you want to give to your client before you apply, to say, let's start gathering these documents because you're going to need them as part of your application. And this checklist is included in your portal, and you can give it to your client ahead of time so that she has everything gathered, so that when you apply, you can immediately upload it for them. If a client doesn't get a decision by 30 days or is denied public benefits, or they're then reapplying is the fastest and quickest way to get benefits along with center-based advocacy. And since you'll have already done it for them once, it will be very easy to help them reapply because you'll already have gone through the process, asked them the same questions. You'll have your sample application with you, which is the application you submitted, and you'll have the supporting documents too, right? So reapplying is the fastest way. However, before you reapply, it doesn't harm to do a little bit of center-based advocacy, and we'll tell you how to do that, which just means making a few phone calls and writing a few emails. This happened to one of our cases last time, and literally we just need to send like 2-3 emails, and they gave our client benefits after 30 days, even though they hadn't initially done that and given them a decision. You can also help tell a client that they can file a fair hearing if they haven't gotten a decision, and then you refer them back to Sanctuary. And if we have capacity, we'll assist them, or we'll refer them out to another agency that can help them file a fair hearing. However, fair hearings take a long time. These days, it's almost taking up to a year to get scheduled. So that's not the fastest way to get relief, but we do want to preserve their rights and make sure that we are also looking at the statute of limitations if necessary. Also, this is a handy tip. You want to list yourself as the authorized representative at the end of the application, because you will see, and I will explain to you why you need to do that. Is if you need to do any advocacy, then if you're listed on the application, they won't ask you to submit a retainer or ask questions or not give you information because you have listed yourself as the authorized representative. It's going to continue now with the annotated application.
Okay, so this is typically what it looks like after you've submitted an application. At the top, it'll say success, you submitted this application, the time and date, and then it'll give you that confirmation number. It's really important to screenshot that and save that, just in case you need to reach out to someone at HRA for the case. Again, if a client does not have an email address, please help them create one. If they do have one, make sure that it's accessible to the client, that they know the password, and that they're regularly checking it. Please create an account and Access HRA with security questions and a secure password. Next, it'll have the household members, all of the names. Make sure that You provide the legal names correctly spelled and it matches immigration paperwork. If there is a name on a social security card, make sure it matches that name. You must report sex as male, female, or X. X is for non-binary and other gender identity household members. The social security number, if a household member has a social security number, you can write it down. If not, that space can be left blank, and then you can submit that advocacy letter at the end. Citizen/national or non-citizen, please select citizen if a household member was born in the US or naturalized. Select national if the household member is an individual who, although not a US citizen, owes their allegiance to the United States. US nationals include American Samoans and Northern Mariana Islanders who choose to become US nationals instead of US citizens. Everyone else is not a citizen/national, is a non-citizen. It'll also ask for marital status. It'll ask if a client has ever been married. Please select appropriate status. Do not select single unless the client is single. It's useful to help, or it's useful to ask clients if they have been married previously, because a lot of them are just answering for right now. You can also ask them if they're pregnant. Household members may be eligible for pregnancy allowance if they're at least 4 months pregnant and have a doctor's note verifying the pregnancy. It'll also ask if you buy and prepare food together, you'll need to state the names of the family members that split the cost of buying food and sharing meals together. Residence and mailing address, please input the confidential address if applicable, and provide a shelter letter as supporting documents if a client is residing in a shelter. If not, you can use a typical lease. Homeless, please select homeless category if the client is street homeless or residing in a homeless shelter or DV shelter. Then for mailing address, if a mailing address is different from the residence address, please complete the section. If someone else receives mail for the client, please place that person's name under "in care of." If street homeless or moving from shelter to shelter, then you can see if you have a PO box. If not, you can put the law firm's address down, so they're still able to get all of those notices. E-notices, we suggest that you don't select the paperless option, as most times clients are not tech savvy or do not have access to a smartphone or won't be checking it regularly enough. So it's good to not get only e-notices. It's good that they receive those paper copies as well. Yeah. For language, there's a multilingual support available. There's Spanish, Russian, Mandarin, Cantonese, Bengali, Haitian Creole, Arabic, Polish, French, Urdu, and Korean. If client's language is not available, then English is the only option. If it is, then the notices will appear in both the selected language and also in English. When a client is calling for their application interview, they can request for an interpreter. Parent, not in household information, you will need to select and complete the absent/non-custodial parent information, who will be sued by HRA for child support to reimburse HRA for the temporary assistance given to the household. So at this time, you'll need to discuss with the client if they need a DV work waiver or child support waiver to be able to provide that to HRA instead of the absent/non-custodial parents information. Cooperation with child support, please check if the client needs or wants a full-in or opt-in OCSE waiver. Cook food at home, include this for every person that lives in the household, regardless if they are applying or not. If a client is not able to cook food at home, they can apply for a restaurant allowance. Disability, please make sure that the client is certified disabled, and if they are receiving a disability benefit like SSI, or if they're disabled/unable to work, can provide a letter for a doctor, and this can also be submitted at the end with all the documentation. School information, if a client is in educational or job search or training program approved by HRA, you can select yes. Other cash assistance benefits, make sure that the client is not receiving benefits in another state. Otherwise, that would be considered double dipping. To apply for public benefits in New York, the client will need to first cancel any public benefits from any other state. Current self-employment income. If a client is self-employed, please make sure to get tax returns for document proof. This is the end of the application. It'll also ask for utility bills, any bills that client is paying, as well as the rent. It will also ask if there are any medical bills in the last, I believe, 3 months, paid or unpaid, that the client has had. And then this is the very end where it asks about an authorized representative. Always put yourself down as the authorized representative. This will get you permission to do advocacy and call in to request in case a client needs a CIN number. Without this, it will be very hard for you to do advocacy on behalf of your clients. So we highly recommend that you put your name and all of your information in that, so it's easy to advocate for your client. If you select cash assistance for the application, this is what the beginning of the application would look like. So it'll show you the 3 steps that you'll need to complete in order to complete the application. After you complete the application and take a screenshot of that number, then you will need to do your application interview. Clients will have to do this interview by themselves. They'll have to call in and they will be asked questions based on the application they submitted. For example, they will be asked to confirm the information regarding income, immigration status, and address. The best thing you can tell your client is to have all of the supporting documents and summary of the application in front of them, ready so they are ready for the interview call. And when the HRA representative asks for any specific details, they have it right in front of them. As a tip, to avoid long waiting times, we recommend that clients start calling the number at 8:30 a.m., which is usually when the office is open. That usually improves chances of getting their call picked by HRA. Please advise your client to screenshot any phone call attempts to the interview line to document their efforts to complete their application interview, even if they're not able to get someone on the line right away. We can take a screenshot and show that they've been trying to have that phone call. You can tell your client to record the date and the time of the call, as well as the worker's name in case you need to follow up with anything. They should also make a note of what number clients call to use the interview line. If the HRA interview line does not pick up right away, clients can select the callback option to save the place in line. This is an option, but it's not guaranteed. So if they don't, they need to be, keeping track if someone calls them back. If someone doesn't, they need to keep calling the HRA hotline number. Please tell clients to keep their phone line free to get a call back from HRA. The number that they called from may be unrecognizable or private, but clients should still pick up the phone. If clients do not get a callback number, they can call the interview line back the following day, and that line is at the bottom. It's 929-273-1872. These are the different ways you can apply for public benefits and or rental arrears. Number 1, submit application through Access HRA online, uploading the supporting documents through Access HRA mobile app. That's the thing too. You will need to submit all of these documents through the mobile app. It won't let you on a desktop. After that, clients will have to call HRA for the interview. This is usually the way we recommend people apply. But there is also the paper application. You can complete a paper application and attach the supporting documents to it and submit it all by mail. And then you will still have to call HRA for the interview. You could also walk to a center and type at a computer station. After that, you will have to submit the documents by scanning at the copier at the center and then call in to do the interview unless it's done at the center. And then if your client has a disability or needs reasonable accommodation request, including help applying for public benefits, they can call the HRA Office of Constituent Affairs. That's 718-557-1399, or they can email the email right there. You can advocate for your client by explaining that they cannot use Access HRA, complete a paper application, or go to a center. And then HRA will do a homebound visit, or HRA used to do homebound visits before the pandemic, but now it's all interface done through the phone. So an advocate should help in sending documents to the center. Okay, and now we're going to start the case studies.
So we have one larger long case study. And I wanted to ask, Sarah, do you want us to take you through the portal instead, or do you want us to do the case study in case people want to read the case study on their own? What do you recommend?
I think probably go through the case study. I think the portal's set up so well, it's self-explanatory.
Okay, sounds good. If we have time in the end, I'll help you all like kind of, I'm already logged in. I can show you around really quickly what it looks like. But as you said, everything is there. You just need to, have a login and find the public benefits section and you'll be good to go.
Yeah.
And I can guide you during office hours as well. So we'll do the case study. Now, definitely we might have to flip back and forth between the slides because it's a lot of information. It's a big family that we're doing a case study for, but the idea is that we're trying to drive home all the points we've kind of learned throughout the training and try to apply it through this case study. So we're going to describe a household. We've made it up, of course. Betty is a national of Peru who has a pending asylum application. Betty has a 13-year-old daughter that was born in Peru, whose name is Camilla, who is a SIGIS Special Immigrant Juvenile Status applicant because she was a victim of her father's abuse. After Betty and Camilla arrive in the US, Betty has a baby Edgar with her abusive partner Tomas, who is undocumented. Betty leaves Tomas after the baby is born because she's afraid that he's going to hurt her and the baby. They have no child support agreement. Betty has an adult sister, Catherine, who is undocumented and has a 2-year-old son, Mauricio, who is a US citizen and receives SSI in the amount of $674.66 a month. Catherine and Mauricio move in with Betty soon after Betty leaves Tomas. Catherine has a phone bill under her name. Betty has a new partner now. His name is Raul, and he is a national from Venezuela, and he has a TPS application pending. He moved into the household about 2 months ago. The 6 of them live in the same household and have no lease. They live in an illegal basement, and only Betty is charged $600 a month. Betty will need the landlord to provide a letter or sign the W-147 form to show Betty's rental obligation if she wants to get rental assistance from HRA. Betty has $300 in utility arrears for electricity and air conditioning. She usually pays about $50 a month in her name for electricity, which is electricity and air conditioning. Betty has a work permit and she works part-time. She works 10 hours a week as a housekeeper and she makes about $15 an hour. She is paid through Zelle. Raul does not have a work permit, but he works for cash on and off and plastic bottle collection. He makes around $75 a month. Betty has about $200 saved in her checking account. Betty has an aunt who does not live in the household, but gives Betty $200 a month. Betty and Catherine cook, shop, and eat food separately. Betty and her family want to apply for public benefits. So let's say you interview a client. This is the kind of very complicated kind of a household that we've kind of come up with to show you all the different people who are living there with different immigration statuses, different incomes, etc. Okay, so now let's see what they're going to be eligible for. So what benefits is the family eligible for? So Betty, Camilla, Edgar, and Raul are eligible for temporary assistance. And why do we think that? Does anybody want to answer that? Let's go back to the first slide. Why is Betty eligible for temporary assistance? Because Betty has a pending asylum application, and based on the policy directive 23TA DC 039, if you have an asylum application pending with a receipt notice, you're eligible for temporary assistance in Medicaid. So Betty is eligible that way. Camilla is eligible for temporary assistance because she is a special immigrant juvenile status applicant, And because she's a SIG applicant and has a receipt notice for it, she's also eligible for temporary assistance. Okay. Who else is eligible? Edgar. Who is Edgar? Edgar is Betty's baby. Betty's baby is a US citizen. He's eligible for all 3 benefits, including temporary assistance. Oops. And then who else is eligible for temporary assistance? Raul. Why is Raul eligible for temporary assistance? Because Raul is a temporary protected status applicant and he has a receipt notice showing that he has this application pending, which again, based on 23 TA DCO 39, makes him eligible for temporary assistance and Medicaid. Okay, so all these people are eligible for temporary assistance. Why is Catherine not included? The sister. Catherine is not included because she's undocumented. And her son is not included for temporary assistance or eligible because he gets SSI. So that's the reason they are not getting temporary assistance, okay? Now, what about Medicaid? Betty, Camilla, Edgar, Raul, and Mauricio are eligible for Medicaid. So everybody who's getting temporary assistance plus Mauricio, which is Catherine, her sister's baby, who is, I think, a US citizen, yeah, and he gets SSI, but he can also get Medicaid, okay, because he's a US citizen. So all of them are eligible for Medicaid. Only the adults in the household can get fair fares. So that's Betty and Raul. And they're getting it because they are applicants, they have immigration applications pending, and they are going to be receiving temporary assistance. And for fair fares, you just have to show that you're getting one kind of benefit at least. So either temporary assistance or Medicaid or SNAP. And if you get any of those benefits, you can get fair fares, which is your reduced fare Metro card, right? Now, even though Catherine is the adult in the household, because she has no immigration status, she's not going to get the fair fares. What about for SNAP? For SNAP, only the 2 babies are eligible. Edgar, which is Betty's baby, and Mauricio, that is Catherine's baby, both are US citizens and they're eligible for SNAP. Okay, any questions so far? Please stop me and ask me. Who should be included in the household size? So for temporary assistance, the household size is 3 for Betty and her 2 children. However, Raul needs to apply for himself as a household of 1 without children, as he is not married to Betty and does not have children in common with Betty. Okay, so we're going to split the households up. Betty and her 2 children, separate case. Raul has his own separate case because he doesn't have any children in common and he's not married to Betty. For SNAP, the household size is 2. Okay, because both the babies are US citizens and they are getting SNAP together, right? Sorry, they are US citizen and eligible for SNAP. Why are we not including Catherine and Mauricio in Betty's household? Sorry, I think for SNAP, let me see, do they prepare meals together is something I need to know. So Catherine cooks, shops, and eats food separately. So sorry, I need to change this. So for SNAP, the household size is 1 for Edgar and separately a household size of 1 for Mauricio. And the reason it's not a household size of 2, sorry for my typo there, is because they don't cook and prepare meals together. If they were cooking and preparing meals together and shopping for food together, then it would be a household of 2. But because Catherine shops separately for her food and everything and prepares her food separately from Betty, that's why they have separate households for SNAP. And since only 1 person in each household is eligible for SNAP, Edgar is 1 baby in the 1 household and Mauricio is 1 baby in the 1 household, it will be separate applications for SNAP for them, okay? Why are we not including Catherine and Mauricio in Betty's household? We are not including Catherine because she's undocumented. Mauricio receives SSI and his income will be invisible for the application, okay? If Catherine had valid immigration status and Mauricio was not an SSI, then they could choose to be part of the application or they could open a separate case. They would have had a choice, okay? And this is the case for temporary assistance. If Betty applies on a paper application, does she need to put down Catherine and Mauricio as non-applicants, but as household members? If the application is a paper application, there is a section to list household members other than the applicants, in which non-applicants can be listed in the application. In this case, it would be Catherine and Mauricio. However, when we do this online, it doesn't give us the option to list non-applicants, and that's why we would leave Catherine and Mauricio out of that application. Okay, so that's exactly what point 5 is if Betty is applying through Access HRA, should Betty add Catherine and Mauricio as non-applicants? No, there is an online glitch on the Access HRA application that only allows for eligible applicants to be listed. In order to show Catherine and Mauricio as part of the household as non-applicants, you have to draft an advocacy letter to show to the effect to show that they are non-applicants but live in the household, and upload that advocacy letter on the Access HRA mobile app in the household composition category. Then we can discuss this during office hours, but it's important to remember that the online application doesn't let you list non-applicants, and that's why we have to upload a separate advocacy letter to explain that and not hide the fact that Catherine and Mauricio live with them, but that they are non-applicants. We have to submit supporting documentation because we can't include them in the application. If Betty is applying for herself and her children for temporary assistance through a paper application, should she include Raul as a non-applicant household member? The paper application allows for Raul to be listed in the household composition section as a non-applicant. He should not be listed in the applicant category, right? The paper application lets you list non-applicants. So you can put Raul down as a non-applicant there in the household composition section, and you can provide an advocacy letter saying that he's a non-applicant. Can Betty include Raul as a non-applicant household member through Access HRA? Again, there's a glitch on the Access HRA system. It doesn't let you list non-applicants. So anybody who's listed there is considered an applicant, and we don't want to list Raul as an applicant because he's a non-applicant. He's going to be applying for himself separately. So we're not going to list him on the application. Rather, we're going to draft an advocacy letter, upload it to Access HRA, and explain that he lives in the household, but he lives there as a non-applicant. Okay. Now, does Betty's household fall under the resource limits for temporary assistance? The resource limit for applicants is $2,500. Since Betty only has $200 in her bank account, her household is under the resource limit, and she is qualified to apply based on her resource eligibility for benefits. Is Betty's household income eligible for temporary assistance, and what grant amount will they receive? So here is where the income eligibility or budgeting comes in. In order for Betty to be income eligible for temporary assistance, we have to take into account her unearned income plus her earned income minus any applicable disregards, and that should be below the standard of need for her household size. So the first step is we are going to calculate the household's monthly gross earned income. Betty only works 10 hours a week and she makes $15 an hour. So her gross weekly earned income is 10 hours into $15. That's $150 per week. And her gross monthly earned income is $150 multiplied into 4.33 weeks, which gives us a gross monthly earned income of $649.50. Now, the second step is to check if Betty can use any disregards. Betty can use the work expense disregard. So you take the $649.50, which is her gross monthly earned income, and you subtract that by $150. And she gets to use this disregard because she's working and that's all she needs to show. And that leaves her with a countable monthly earned income of $499.50. Betty cannot use the earned income disregard or the new total income disregard as a household is applying for cash assistance for the first time. Okay. Now, the third step is to see if Betty's earned income after applying any disregards. So Betty's earned income after applying the work expense disregard is $499.50, and that's the only disregard that's applicable to her. The fourth step is to check if Betty passes the income eligibility test. And what is that? It's unearned income plus earned income minus any applicable disregards has to be less than the standard of need. Standard of need for a household size of 3 with children is $789. So we take the unearned income from the aunt of $200, and then we add the earned income minus any disregards, which is 649.5 minus 150, and that equals to 699.50. Since Betty's unearned income plus earned income is less than the standard of need, S is income eligible for temporary assistance because 699.50 is less than the standard of need for a household of 3 with children, which is 789. So she passes the test. Her household passes this test. The fifth step is to calculate the temporary assistance grant amount for Betty's household. So the standard of need equation is the standard of need minus unearned income plus earned income after applying any applicable disregards will give us the grant amount. The standard of need for a household size of 3 with children is 789. And then we subtract the unearned income of 200 plus the earned income after applying any disregard, which is 499.5. So 789, which is the standard of need, minus 699.5 leaves us with a grant amount of $89.50. So Betty's household is income eligible for temporary assistance, and she will get $89.50 in temporary assistance for her household size. Okay. How can Betty fulfill any questions so far? Is everyone following? I know it's a lot of people living in that household with lots of different immigration statuses, but I just wanted to take you step by step. How can Betty fulfill her HRA temporary assistance work requirements? Since Betty has a work permit, so not only does she have an asylum application pending, she has by now also received her employment authorization document and has a work permit. She has to comply with HRA's work requirements. So till she got her work permit, she didn't have to. But now that she has a work permit, she has to comply with the work requirements, right? So Betty has to show that she is working 30 hours a week since she has dependents, not 35. If she didn't have dependents, she would have to show a minimum of 35 hours a week. Because she has dependent children, she only has to show 30 hours a week. So we have to tell Betty, you need to work at least 20 hours more, or enroll yourself in an approved education or training program, or find employment for 20 more hours, so that this totals up to 30 hours a week. Now, the higher the amount of hours you work, the higher your income becomes. And it's very likely that if she increases her hours, she will probably not be eligible for anything after the disregards. So we can't tell her not to increase her hours, but we can say this is your income limit. If you work more than this amount, you are going to not get cash assistance. So you can either enroll yourself in a training or education program, or if you so desire, increase your work hours. But remember, you might not be eligible for cash assistance anymore. Or if you are already in cash assistance, you might lose it, or it might get reduced as you work more. So, and if you don't find your own employment or education or training program that's HRA approved, then HRA will place you in a program, an education or training program or a job. And Betty cannot refuse, because if she does, she's going to be sanctioned. So it's probably better for Betty to find her own job for more hours, or increase her hours, or enroll in an education or training program if she doesn't want to get whatever HRA is giving her. Okay. Also, since she's already working, she cannot now ask for a full work waiver, but she can ask for an opt-in work waiver so that she's not placed by HRA in an unsafe borough to work. You can't now say, I want a full work waiver, because she's already working. You can't now say, now it's dangerous for me to work, right? Because she's already working. If she wasn't working, she could say it's too dangerous for me to work because it would put me at risk of further abuse, or it would make it more difficult for me to escape the abuse, right? And that's why I need a full work waiver. However, Betty can't do that because she's already working. So she can only ask for an opt-in work waiver if necessary. Will Betty have to cooperate with HRA's child support requirements for cash assistance? Betty can ask for a full Office of Child Support Enforcement waiver if she feels like the child support requirements would endanger her and her children's lives or put them at risk of further abuse. However, in this scenario, HRA will probably not pursue child support against either of Betty's children's fathers. And that's because one of them has already, I think, left, right? I think he was deported. Let's go back. Let's see. in our example, it said Thomas is undocumented and she left Thomas and there's no child support agreement. So here, if the client asks for a full waiver, then the HRA will not go after either of Betty's children's father because there was abuse with both the children's fathers, right? So Betty's daughter was abused by her father. That's why she was able to get the SIJ application pending. And, Betty's father of Edgar, Thomas, was also abusive to her. So she can ask for a full child support waiver for both of them, but she needs to identify as a survivor on the application of domestic violence, get a special assessment interview, and ask for a full child support waiver. However, if Betty says, no, I don't want a full child support waiver, I want HRA to pursue child support against Edgar's father, she can ask for an opt-in child support waiver. Okay? In which case HRA will suppress her address and not have her come to court, but they will still pursue child support against Edgar's father. Since Thomas is living in the US and he is a non-custodial parent, Betty can explain her history of abuse and ask for the opt-in waiver so that her address is confidential and protected. She will also not be required to come to family court for the child support case. With her daughter's father, I think he's still in her country of origin. So HRA will probably not pursue any child support against him because he is living there. Betty can ask for an opt-in one second. Yeah, that's exactly what I said. He's out of the country for Camilla's father. So it's very unlikely that HRA will pursue child support against him. But again, if Betty wants HRA to, enforce their child support rules and she wants to cooperate with them, she can ask for an opt-in waiver. However, it's very unlikely that HRA will pursue the child support case against Camilla's father because he doesn't even live in the country, and that will just be very expensive for them to do. So you can just explain that to her. Betty can also not choose to ask for any waivers for child support. It's her choice. So whether it's for work or for child support, it's her choice whether she wants any of these. Can Betty apply for a one-shot deal of $300 to cover her utility arrears through her cash assistance application? Absolutely, yes. If Betty says that she has rent or utility arrears on her cash assistance application, that application for cash assistance also becomes an application for a one-shot deal. So if she puts that down, she is by default signing a repayment agreement of the $300 loan over the next 12 months. And you have to let Betty know that she is signing that loan agreement. However, you can check to see if Betty's household is eligible for an EAF grant or an EA grant. And if it is, you can try to do advocacy with the rental assistance unit at HRA to see if they'll convert it. But most likely or not, they probably won't, but it's still worth a shot and we still try. We always try. If a client is eligible for those, we still try to do advocacy for our clients to try to have HRA convert the grant from an SNAT to an EAF or an EA. Can Edgar and Mauricio apply for SNAP on the same application? No, since Betty and Catherine cook, shop, and eat food separately, they constitute as two separate households and cases for SNAP. So how do you know, how much Edgar will get in SNAP? So here we have filled out a SNAP budget worksheet. We already took you through this earlier, so I'm not going to go through these numbers, but you can follow along on your own time and see how we got to the estimated benefit of $292. Just really quickly, we know that Edgar's mom makes $600 a month. So that's the earned income. The unearned income is $200, and that's the money that they get from family and friends as unearned income. So the gross income is 600 plus 200, that's 800. That goes on line 3. They don't pay, Betty doesn't pay any child support, so she doesn't have to put down anything here. We put down 0. So the adjusted gross income is 800. Betty gets an earned income deduction because she's working. So 600 multiplied by 20% is 120. The standard deduction for the household size is 204. That's listed on the second page of the budget worksheet. They don't pay any dependent care, so that's 0. They are not street homeless or couch surfing, so we don't put down anything in the homeless reduction. There's nobody elderly or disabled in their household, so we can't put down any medical expenses out of pocket. So the total deductions we add up are 324. The adjusted income is line 5 minus line 11. The rent or mortgage is basically 600 because that's what Betty actually pays to the landlord. However, because she doesn't have a lease, she basically will need the landlord to sign the W-147 form or give something in writing that she pays that amount in order to put that down as rent. The standard utility allowance, since she pays for electricity, including air conditioning, is the highest level. So she gets to put down 1,034 here for that. There's no other shelter. This is usually if somebody is paying a mortgage and is also paying property taxes. Usually you would list down the property taxes on this line. We add up the total shelter expense and that comes to 1,634. For line 17, we take line 12 and divide it by 2. So we get 238. Again, you can have your calculator handy, running the calculations with me as I'm going through this. For shelter amount, they only let you put down up to 712. So even though her total shelter expense was 1,634, we can only put a maximum of 712 down. So it gets reduced to that amount on line 17A. Her net income, which is line 12A, 12 minus line 17A, is 0 or a negative number. So it's 0. The maximum SNAP benefit for a household size of 1 is 292. And since line 18 is 0, when you multiply 0 by 30%, you still get 0. So the estimated benefit is line 292, which is line 19, which is 292 minus line 20, which is 0. So that means that Edgar will be getting 292 in SNAP benefits. And I think that's the maximum amount for a household of 1. Similarly, we have calculated how much Mauricio will get. Mauricio will get slightly less. Mauricio will get 150.8. Again, you can take out your calculators, look at the case study and calculate this yourself. We've already taken you through one SNAP budget worksheet. Hopefully you'll be able to figure this out. But I think one of the main differences here is there's no gross monthly earned income. And also the 674.66 is from the SSI as unearned income, but there's no other outside household member or family or friends giving them additional unearned income here or money to support them. And also they are not paying any rent, they're not paying any utilities, etc., other than a phone bill. So they get the standard utility allowance of $31. So how much will Raul get in cash assistance? So Raul is Betty's new boyfriend and he's applying for himself. So Raul is not subject to the HRA work rules because he does not have work authorization yet. However, his income will still be counted for his application. So he's making $75 weekly, which means $324.75. And how do we calculate that? Is we take the 75 and we multiply that into 4.33 weeks, which leaves us to a monthly amount of $324.75. Will he be able to get the work expense disregard because he's working? Yeah, he gets the work expense disregard just because he's working. He doesn't get to get the earned income disregard because he is not currently a temporary assistance recipient. He doesn't get the earned income disregard because he was not getting temporary assistance in the last 4 months. And he also can't get the new budgeting rules applied to him either because he's not currently a temporary assistance recipient. He's applying for the first time. So in order to figure out how much will he get in benefits, we look at his unearned income, which is 0, plus earned income after any disregards, which is 174.5. And that has to be less than the standard of need for a household of 1 without children, which is 158. And since 174.75 is more than 158, it's a negative number. That means Rahul is going to get $0 in temporary assistance. So there's really no point in helping Rahul apply, because if we budget him when we're checking his eligibility for benefits, even though he would have his own separate household, he is over income to receive cash assistance. Okay. So who is eligible for Medicaid, and should everyone apply together or not? Everyone but Catherine is eligible for Medicaid because Catherine is undocumented. So she can call up the New York State of Health and see if she can qualify for any of their other plans. And if not, she can enroll herself in the New York Care program at one of the participating hospitals. For the purposes of Medicaid, there are 3 households. First is a household with Betty, Camilla, and Edgar, and they are going to apply together by calling the New York State of Health before they apply for temporary assistance because they are magi. Okay. The second household is for Rahul. He's going to call up the New York State of Health before he applies for temporary assistance because he's magi. Here, he's not even going to be applying for temporary assistance because he's not eligible, he's over income for it. So the only thing he really needs to do is call up the New York State of Health because he's magi and get Medicaid from there. However, if he was eligible for temporary assistance income-wise, then he would apply for Medicaid through New York State of Health first. The third household is Mauricio's. Catherine needs to apply on behalf of Mauricio. So she can't apply for herself as he is certified disabled and gets SSI, and he is non-magi. So she's not going to be applying to the New York State of Health. She is going to be applying for Mauricio's Medicaid through Access HRA. Okay. And for Catherine herself, she needs to enroll for the New York Care program. And if she has an emergency, she can go to an emergency room and see if the treating doctor will label it as an emergency, and so she can get emergency Medicaid. However, that's a risk that you take when you go, because you don't know if the emergency room doctor will qualify that, right? So obviously you're not going to get it for chronic conditions, but you will get it for emergencies, for example. And so is anyone in the household eligible for Fairfares, and how do they apply for it? To get Fairfares, you need to be a resident between the age of 18 to 64. That means only Betty, Catherine, and Rahul can get Fairfares. Okay. Here, just some handy frequently asked. I just wanted to show you what's in the Pro Bono portal since we can't go through it. This is like a list of things that are on there. Don't have time to go through it, but that's the link to the portal. And all of these things are listed there. And of course, we'll talk during office hours. Any questions? I realize it's exactly 1 o'clock and we finished just on time, but I don't know if we have any time for questions. I am available if you all have any questions for Hannah and I.
Thank you so much, Sonia. And yes, perfect timing. I think now I love that people should go to your office hours. So at least for the McDermott folks, we will assign the case. You'll receive an email with your assignment and then go through to set up office hours the following week and then reach out to your client to get started. So they'll be able to put all their questions together and bring them to you at that point, Sonia, which I think will be a great way to get started.
Thank you so much again, Sarah, for hosting.
Thank you.
To McDermott and Covington for hosting the training. I really, really appreciate it, for all your help and support. And I really look forward to working with all of you. Thank you so much.
Thank you. Thanks, everyone. Bye-bye.
Bye.